Hello everybody, my name is Gary Van Wettering and I'm the Director of Facilities here at Lakes Regional Healthcare, and today I want to talk to you about a negative pressure isolation room. Behind me is the one negative pressure isolation room that we have here at the hospital, and we are looking to raise funds right now to add an additional one. So we want to walk you through the key components and give you a little education. The first thing that you will notice is what we call an anteroom. So here we are in the anteroom of our negative pressure room, and the purpose of this anteroom is to provide an intermediate space between the patient room and the corridor. And basically it provides a space for the medical staff to store certain items, to put on and take off their PPE, and to wash up prior to exiting the patient care room. So now we are actually in the negative pressure patient room. We've exited the ante room and we're now actually in the room. And basically the reason why hospitals have negative pressure isolation rooms is to prevent infectious germs or particles that are in the air inside of this room from getting into the HVAC system and spreading out through the rest of the patient area, or getting literally through the doorways and getting out into the corridors. Okay, so the inside of this room really doesn't look anything different than any of the other inpatient rooms that we have once you're inside. But there are several key components that you don't see that are key to the operation of this room. One would be valves that are above the ceiling in this room that very accurately control the amount of air coming into this room, HEPA filtered air, and the amount of air exhausting out of this room to the outside through HEPA filters. So the way this room works is supply air is brought in at a very controlled rate, and air is exhausted to the outside at a higher rate, causing the pressure in this room to go negative. So it's actually trying to pull air in out of the hallway. Another critical component of any pressurized room, whether it's negative or positive, is a room pressure monitoring system. And basically that is a digital device. It's located inside of the anteroom, and it is comparing the pressure inside of the room to the pressure in the corridor. And it's a good visual for the medical staff as they enter the room to make sure that it's negative. And it's also something that maintenance and facilities staff will monitor and record on a daily basis. So in order for Lakes Regional Healthcare to add another negative pressure isolation room in our efforts to deal with additional COVID patients, it would end up being a construction project. The biggest thing from a physical perspective is we would need to add an anteroom, because most of our inpatient rooms do not have an anteroom. So that would take some physical general construction. In addition, we would need to do some HVAC work to put in these precision controls for controlling the airflow in the room and exhausting it outside. All of that would need to be tied into our building automation system, so it's controlled and we can monitor it and tweak it as needed. There would need to be electrical trades, sheet metal trades, finish trades. So it would end up being a miniature full construction project.
Hi, I'm Sonia Ham with Lakes Regional Healthcare Foundation, and we hope that this video really helped explain what our holiday appeal is for this year, that negative pressure room that is so important in controlling those infectious diseases here at the hospital. We just wanted to let you know that this is a perfect time to reach out and donate this year, and this is a really great effort that we have going on here at the hospital. If you have any questions or are ready to donate to this project, please contact me, sonia.ham@lakeshealth.org, or by calling 712-336-8791. And we've also made it convenient to donate online at lakeshealth.org. Again, thank you. Many of you have been so generous already to this point. We just wanted to give you a little bit more information about what we're trying to accomplish with this year's holiday appeal. So happy holidays, Merry Christmas, Happy New Year, and thank you.